Good morning. Today I'll be talking about women and mental health, what we need to know. So first I'll talk about premenstrual disorders. This premenstrual disorders usually occurs 1 week prior to the onset of periods or the menstrual cycle of the women. Usually almost all the women will exhibit certain characteristics like crying spells, irritability, lower abdominal pain, nausea, vomiting, which is very commonly seen in most of the women who are having their menstrual cycle, which usually doesn't need any intervention, and that will go by itself. But 30% of the population of women who are having their menstrual cycle can have little more vigorous symptoms of this same kind which I have explained. That will also go without any medication. And the rest, that is the 8% of the population, they may have severe irritability, reduced sleep, anger, crying spells, etc., which may need intervention. And what they can do for themselves to get relief from this is make a good sleep hygiene, eat plenty of fruits and vegetables, drink lot of water, make sure that they avoid coffee and tea during the evening period, and have a good chat with their friends and their family members, which can help them to get rid of this kind of menstrual disorders that occurs during the menstrual period. And even if after that, if this is not getting cured, they can seek the help of a psychiatrist so that medications can be given. And coming to the second thing which occurs in women only exclusively, that is after their delivery time, that is postpartum blues. Postpartum blues also occurs in majority of women because motherhood or the parenthood itself is a kind of increased responsibility for the mothers. So they may have increased worry about how to rear up the baby. They may have crying spells, they may have sleep disturbances because of the baby's cry and all, which is commonly seen, that can start as soon as after the childbirth and may maximum exist up to 7 to 10 days, which need usually no medical intervention. Care and affection from their husband and the love family members is sufficient enough to help the mother to come out of it. The next is postpartum depression. Here it usually starts after the childbirth and can go up to 6 weeks after the childbirth, which is characterized by pervasive low mood, irritability, crying spells, lack of appetite, suicidal ideations, feeling that they may do some harm to the baby or something kind of illness will come to the baby, etc., and they may land up in trouble for themselves. These people may need medical intervention. They have to see their psychiatrist or psychologist and have to take the help. The third thing is the postpartum psychosis. Same like this, postpartum psychosis also can happen within 6 weeks of childbirth. This also happens because of the hormonal dysregulation which happens after the birth of the baby, which happens to the mother. There is imbalance of a hormone called dopamine. That dopamine hormone is the reason for this postpartum psychosis, where the patient can have hallucinatory behaviors, that is, they can hear the voices without the voices actually exist, and they can have delusions like have false beliefs that someone will harm the baby or the baby itself is a harm to them. And there are instances that there is a homicides which has happened to the baby and all. They can also be treated. They need antipsychotic medications which can regulate the dopamine levels of the mother. There are exclusively a large number of medications for the postpartum depression and for the postpartum psychosis, even for breastfeeding babies. They can safely take it along with the rearing up of the baby, and usually within 6 weeks to 6 months period we treat them, and they can actually come out of the medications and can have a happy life. Only thing which we have to say is try to reduce the stigma of psychiatric illnesses so that the majority of the women or the human beings, the normal of us, can approach the doctor and they can get the treatment and they can avail the treatment and can lead a normal life. Thank you.